you. Time for our Health Watch this morning, where we discuss all of the topics trending in the medical field. Tim is in the studio with Dr. Syed Hussain this morning. Good morning.
Yeah, it turns out there's a lot of topics trending because there's a lot of viruses and sicknesses trending. So a lot to get to. Good to see you again.
It's the season, likewise, Tim.
Yes, Happy New Year. It is the season, but it does seem like it's a little bit late in the season. And we'll get to that with like norovirus and COVID too. But the bird flu, that's something that's sort of been on people's radar, but a little bit in the back. Now we found out the first U.S. death from the bird flu has happened. So I don't know what exactly to make of that.
So first things first, don't want viewers to panic.
Yeah.
We're not seeing large human-to-human transmission of bird flu.
Are we seeing any?
No, not yet.
Right, okay.
So this was a gentleman, I believe this case was in Louisiana, but a gentleman, 65 years of age, multiple medical comorbidities, Tim, and also was dealing with sick or dead birds in his backyard.
Yes.
So that's how we think he contracted the virus, and the virus actually mutated in him. So don't want folks to get alarmed. What I would say in terms of general precautions, if you're one of those individuals that deal with poultry or birds, then it makes good sense to actually take some precautions, such as wearing eye protection, respiratory protection, gloves, the common sense things that we know protect us from viruses.
How are they getting from the birds to us? Is it through waste products, feces, things like that?
Yeah, there's probably, it still needs to be looked into as to how this transmission is coming about. Right, like I said, there's not large-scale transmission. So since last year, March, we've had 66 confirmed cases of bird flu in North America.
Okay.
So in the larger scheme of things, while it's low, we can't guarantee that all cases will be mild.
Right.
And we may see some incidents like this, but so far, there's no human-to-human transmission.
So that is good. All right, moving on to other viruses, right? COVID flu, it seems like they're starting to peak a little later, or at least start the ramp up to peaking a little later. And now we're seeing norovirus, too. We've been talking a lot about that.
Yeah, it's almost like a double whammy. Most of the country, almost 40 states, Tim, are seeing really high or very high flu numbers right now. New England, not so much at the current time. RSV as well, since November, especially in children. But to your point, norovirus has peaked this year, late last year as well, more so than previous years. And so it causes nausea, vomiting, diarrhea, abrupt onset, usually self-limited, resolves in 1 to 3 days. There is no treatment. It's symptomatic management. And again, taking those basic precautions and washing your hands, hygienic precautions is important.
Yes, and while this is certainly not the deadliest threat we have with norovirus, you don't want to sleep on it because, like you said, it will resolve in 72 hours. But
especially in people who have underlying medical problems, because they can get dehydrated. It can lead to other issues. So it's really, really important that you hydrate yourself if you do come down with something like this and seek medical attention.
It sounds to me, though, like, take COVID, for example. Some people could be infected, not even really know it.
That's
with
right.
Norovirus, boy, it'll run right through you.
Yes.
You'll know. It is not going to be a fun 72 hours. So do what you can.
And before we move on from this topic, for the flu, it's still not late to get that flu shot.
Absolutely not. Yeah.
So it's important as we still go through this season.
In fact, it might even be a little more advantageous because if the season is starting a little bit later, it might peak a little later, so that protection will last a little longer. All right, another big thing that's trending. The U.S. Surgeon General earlier this week called for a label, a warning label on alcoholic drinks to let people know that there's, I guess, an even stronger link now between alcohol consumption and cancer. What is that link?
Yeah, in the medical world where it's well known, alcohol consumption, high consumption can lead to up to 7 types of cancers.
Yeah.
Tim, including liver, throat, breast. So the last time something like this, a label on alcoholic drinks was revised was almost 4 decades ago. Medicine has come a long way since then. The only other parallel that I see between what's being attempted now is with cigarettes. And we saw cigarette smoking consumption go down, for instance, in this country because of those labels and just more heightened awareness of what it can lead to.
Did essentially this latest guidance sort of lower the threshold on how much alcohol you would have to drink for your risk to get cancer to at least go up?
So current guidelines say 1 drink or less for a woman and 2 for men. Might be revised. We still have to see the full guidelines that are released, but this will require an act of Congress to be able to change something like this. But it all goes hand in hand with the new federal regulations that will come out later this year on healthy food habits and new labeling on food products.
Right. We had a lot to get to. We got to it all. Dr.
Yes.
Syed Hussain from
Thank
Trinity
you.
Health in New England. Thank you so much.